Well, thank you very much for joining us for the mission focus video. This is part 4 of the video series that introduces missionaries in the local community who are passionate about what they do. And today that we have Lloyd DeFoor, and he's been in the mission trip for the many years, and so that we are asking him about his experience and what he's passionate about and why he's passionate about. So just to tell me about yourself just a little bit, and as we are going into the subject.
Okay. First of all, thank you for what you're doing for Christian Medical and Dental Association in the Augusta area, and also Global Health Outreach. You're a huge asset to our organization. And I started going on mission trips in 2000 and started going with GHO in 2003. And since then, I've probably been on 70 or more trips. And it's my favorite thing to do. There's nothing like being able to serve with people that love the Lord and love people, and I have been extremely blessed to be able to have been with many people from around the country that are some of my best friends now.
I know that I interviewed about 3 people so far, and that you're very unique in that category because you're not either medical or dental, but you are part of the medical mission trip. So if you can just tell us about how you got involved with this ministry.
Dr. Andy Sanders, who was the previous CMDA director in Augusta, was also the teaching leader at Bible Study Fellowship. And during some of Andy's lectures, he would talk about his mission trips. And I was going on mission trips with another organization at the time, and I told Andy I'd like to go with him sometime. So I started going with Andy, and as trips and time developed, I started helping him with the administrative part, and as he was practicing medicine, I'd go around to the different clinics and so forth, make sure that things were going well, and it just evolved. And then Dr. Emmanuel Go from Augusta, we were on a trip to Honduras one time, and he said, you know, I'd like to lead a trip to my home province in Bafut, Cameroon, Africa. I said, well, Manny, put it together and I'll go with you and help you. And then Dr. Frank Emirato from New York originally, now in Hilton Head, we were in Moldova one time, and he said, the Lord is leading me to lead trips. I said, well, Frank, get it together and I'll go with you and help you. And then Dr. Andy Lamb from Burlington, North Carolina, he said, the Lord is leading me to lead mission trips. I said, well, Andy, get it scheduled and I'll go with you and I'll help you. So I started going with them years ago and assisting them, and they're 3 of my best friends in the world. The GHO director sent out an email to us and said that you know, we needed more leaders, and so I just took that as a sign from God that it was time for me to start leading trips. So I started leading, and also going with, we had other people that were leading trips for the first time, and I started going with them to assist them on their first trip.
If you can just share maybe 1 or 2 stories that is very memorable in your 20 years of your GHO.
It's hard to limit them to 2. I remember one time we were in Cameroon with Manny, and it was a 2-week trip, and over the middle weekend we went to a lot of different churches, and we got back on Monday, and there were thousands of people wanting to see our American doctors and dentists and so forth. And I remember asking Manny, I said, Manny, are there any policemen around here? And he said, what policemen? So anyway, we had a big, one of the lead preachers was a big man with a deep voice, and he got up and started praying with people, and he calmed people down. And one of the things that I remember the most, and this touched my heart as much as anything, is we were in El Salvador, and in El Salvador, our translators are pupils in the Christian school with the church where we partner, with whom we partner, and we started. They started meeting with us, and in the mornings during our worship services, and and we shared devotions and testimonies, and one of the young people came up and they asked if they could share the next morning, and I said, sure, we'd love for you to. And there were one young man and one young lady, and then the young man spoke first. He did such a good job talking about how much he loved the Lord and stuff, and then the young lady got up and she said, you know, I love the Lord and I'm going to serve the Lord, but if I have to, I'll die for him. And that's a reality in a lot of the places where we go. But I remember going to Moldova one time, and we do home visits, and we went into the home of this elderly couple, and they didn't have any family that were nearby that cared for them, and we went in their small house, and then the man was laying in bed and his wife couldn't care for him, and he had he had gone to the bathroom. He was wet, all his bed clothing and all the beds and everything else. And anyway, we got some young people, and they came in and got on their hands and knees, and they scrubbed that floor. And we had our young doctors that came in, and they looked after that man and lady, and he had bed sores on both hips that were all the way to the bone, and you know, they loved on those people so much, and you see that over and over on these trips. And I love to go with young people because they are so passionate about the Lord, and if you can get them out there and they serve, and you know, our young people get a bad rap, but we have some of the best young people in the world right here, and they're so far, so much farther along in their spiritual walk than I would ever thought about being when they were going on, or when they go on these mission trips.
I think that we tend to think that we go to those places and provide the service, but actually that we are the team that get a lot more blessing.
That's right.
I think that's the big part of just, you know, short-term mission trip is the fact.
Yeah, with these mission trips, we don't go anywhere that we're not asked. We go when we partner with some organization, a church, or whatever, and we bring credibility to that church and help them grow, and we encourage the pastors and the church people, and it's wonderful what we're able to do. We minister and we do the best job possibly in those situations, medically and dentally, and with eyeglasses and the pharmacy, and we have children's ministries and stuff, and we minister to people, and it's just a great opportunity that we have to share the love of Jesus with them. And the translators, usually we have the best and the brightest of whichever country we go that are our translators. But the thing that is most important to me is the team, because I'm a realtor, I'm in the real estate business, but people in the medical profession, they still have a lot of credibility. And if we can get our doctors and dentists to get it, and just to hear and see how important it is to love people, and when we ask them to pray with every patient they see, and then when they come home, a lot of them pray with their patients. And I've heard in the last couple of days here locally that some people have been in the hospital and they were so impressed because their doctor took time to pray with them.
But now, like, we are, the GHO start sending more teams to the many different places, and as we are looking for more participants, what would you like to tell people who might be thinking about going to the mission trip?
You know, I've been fortunate to be able to do a lot of things in my lifetime, traveling around the world, and I've just been one blessed human being. But to me, there's nothing like serving on one of our mission trips, because we're with absolutely the best people in the world that go with us, and we get up every morning and we start with having devotions and testimonies and worshiping the Lord. And then we go serve, and serving side by side with people with like minds, and being able to serve people and seeing people get it. Not only in the countries where we live, but seeing our team members get it. And there's nothing more exciting than that to me. You know, we work hard, we serve hard, but we have a good time while we're doing it. And one thing that I would also tell you, that there's nothing better than for a family to go on a mission trip, or a father and a son, or a father and a daughter, or something. It just helps build a relationship like you can't have anywhere else and stuff. So if you've got thinking about your family, going on a vacation, this is a great vacation for your family, or if you just want your family to be able to see how the majority of the world lives. It's a great cultural experience also. But mainly, it's a time for us to grow together in a relationship with each other and a relationship with the Lord.
If you can just say any last word that you would like to tell people about the GHO and then hold a mission trip.
I've been fortunate to be involved with a lot of different ministries and do a lot of things. And I've said this many times, I don't know of another ministry that does more for the kingdom than Christian Medical and Dental Association and Global Health Outreach. When you look at all the different aspects of what CMDA does with what you do with the students and all the stuff at AU and the different organizations that you partner with, and then when you look at what GHO does around the world, sharing the gospel, encouraging church leaders and the leaders of the different organizations in which we serve, the amount of time that we pour into the translators and the different people in the churches. And we'll be in country 7 days, 14 days or something like that. But I learned a long time ago that when we leave, we can leave missionaries on the field, and we can do that by helping equip the people of the churches and so forth and encourage them to share the gospel after we leave. And that may be the most important thing that we do in country is it just helps open the doors for people to get in their churches. It helps grow their churches. And so it's a wonderful opportunity that God has given us through this organization, and to be able to do what we do and have a great time doing it and grow in our relationship with the Lord.
So thank you very much for today and for your time, and a Godspeed.
Thank you, Misaki.
Thank you.